Here are my basic treatment principles in a breathwork session. Many of these principles apply to any healing work, but I find them especially important when working with a client experiencing the symptoms of severe trauma. These principles stem from my clinical work going back to 1970. Number one, safety first. Establishing basic safety starts even before treatment officially begins. Clarity and working agreements and safe boundaries are often issues violated by the client's original trauma and easily re-stimulated if the practitioner is unaware of their initial contract, be it on the phone, by email, or in person. Being open and accepting on the one hand and clear and boundaried on the other are the parameters of safety that lay the groundwork for a successful partnership in healing. Practitioners who deal with trauma and use techniques involving non-ordinary states of consciousness, such as breathwork, need to have done enough of their own personal work to be aware of their own needs and how not to get them confused with the needs of their client. Unless the practitioner has enough inner safety with their own dynamics, it will be nigh impossible to convey safety to a traumatized client. 2, a collaborative approach. The truth is that no practitioner knows all of what's best for a client. If the practitioner does not listen and learn from the client, they are operating from general theory rather than interaction with a live person. Establishing a collaborative approach from the onset takes the practitioner out of the role of the expert who knows the answers and is responsible for all the healing. 3, experimental attitude. Given a working rapport, the practitioner must be flexible enough to abandon a technique that's not working, rather than abandon the client. Even during sessions, I will ask a client if they're willing to experiment with a way of breathing, moving, or vocalizing. Number 1, their agreement gets them on board with it. Number 2, it reduces some of the performance anxiety around having to do it right. Number 4, forgiveness. The more these principles are established, the easier it becomes to deal with the inevitable issues that challenge and arise in the emotionally charged setting of trauma work. We begin to accept our so-called mistakes as learning opportunities that actually create more safe closeness and self-forgiveness for the client. Spirituality and breathwork. For many, using breathwork in dealing with trauma is greatly aided by including the spiritual dimension directly in their healing process. Now, clients may not have a model of spirituality or even an antagonistic response to spiritual concepts or language because of negative religious associations. It does not take overt talk about spirituality to include this dimension in the healing process. We can observe resources in an individual that go beyond their reason or willpower, emotions or behaviors. Now, call these resources what you will. They can be crucial in relieving much suffering on the healing journey. If not summoned through traditional forms like prayer or meditation, they may be invoked with, quotes, inner child visualization or guided imagery. This has been research verified again and again. It behooves a practitioner to explore and utilize the resources of the client rather than impose or try to replace the client's spiritual approaches with their own. Even in the case of religious trauma or avowed atheism, there's often a way that an individual relates to higher principles of kindness, respect, and compassion, for example, that go beyond their egocentric interest and point to a higher part of themselves. For those open to it, after validating their basic organic self-preservation instincts of anger and self-defense, they may be ready to accept a resiliency in their spirit that can put the trauma in a larger context than just a victimization that leaves them permanently damaged, or something they deserved for wrongdoing or unworthiness on their part. The spiritual perspective can help give a broader meaning to the trauma and consequently further catalyze the healing process. How to identify clients who will most benefit from breathwork applications. Breathwork has been successfully used from time immemorial and in most cultures around the world to address issues of health and well-being, to bring harmony and equipoise to mind and emotions, and to explore realms of spiritual growth. For psychotherapy clients today, it addresses conditions including building self-esteem, building confidence, grief, anxiety, depression, repressed and overt anger, psychosomatic healing, pain, spiritual crisis, spiritual growth, resolving physical and emotional tension, preparation for childbirth, relaxation, changing mental patterns, and transforming addictive behaviors. Now, the positive indices for client suitability for breathwork include their interest, sense of trust, a desire for personal growth, a desire to use mind-body techniques for healing, and a willingness to take responsibility for their own health and wellness with the assistance of guidance and support. Contraindications in evaluating appropriateness for breathwork intervention and trauma recovery include A. Assessing the current level of a client's executive functioning. If the client with trauma is able to maintain contact with an inner adult, a witness observer, or an aware ego that's friendly towards themselves, breathwork can be a powerful and activating pathway for releasing trauma, trauma resolution, regain true and present sensations, feelings, and thoughts, resiliency building, and self-actualization. If the client is in a dissociative state, panic, or psychotic process, neither faster or lower than normal breathing may be effective or could be counterproductive in reestablishing stabilization physically or mentally. 2. Physical limitations. If a client has asthma, COPD, chronic obstructive pulmonary disorder, or other diseases of the air passages, air sacs, or pulmonary vessels, hyperventilation syndrome due to physical disease such as the Epstein-Barr syndrome, etc. Breath awareness may be an appropriate adjunct to treatment, but specific breath modulation protocols are necessary for safe, slow, or faster than normal interventions. Third, practitioner readiness. Though breathing is a normal human activity, when using breath modulation in treatment settings, practitioners must be adequately trained with the appropriate techniques. Even with trained practitioners, some clients may present issues beyond a practitioner's scope of practice or personal comfort zone. In such cases, referral to a qualified trainer is called for, or, if not available, a discontinuing of breathwork intervention is appropriate. And 4, client groundedness. Although breath practices are particularly useful in helping most clients become more safe and at home in their skin, when treating a client with trauma, there are times when any outside facilitation may not feel safe. Breathwork with clients with trauma should never have an element of pushing or force, only encouragement. Discretion is necessary to bring a client to a place where they are comfortable and willing to be coached in breathing. The goal in breathwork intervention is increasing self-regulation, establishing rapport in which the client understands, at least on some level, that they are in charge of their inner process is a prerequisite for successful coaching, especially with traumatized clients. Ethics in breathwork. The best known summary of an ethical model of which I'm aware comes from the therapist Kaelia Taylor in her book, The Ethics of Caring. The issues that arise in work with non-ordinary states of consciousness are in some ways like ethical issues in ordinary states of consciousness, but non-ordinary state issues are more wide-ranging and more subtle. For example, the need for safety is greater, such as providing more clarity about informed consent, boundaries, roles, money, and time. In other ways, ethical issues can be quite different in these states. For example, if a breather has an experience of cosmic oneness, and the facilitator somehow tunes into that and has an experience of merging with the client, the facilitator has the unique responsibility to consciously and accountably come back to ordinary consciousness, time, roles, responsibilities, and to help the client do the same. Also in these states, one needs to be aware of and accepting of a greater range of experiences, such as all the transpersonal experiences described in the Graph cartography, which occur with much more frequency in breathwork sessions than ordinary therapies or techniques. Breathwork is a technique where talking and touching and sacred experiences often occur in combination. Together, they can have a potent synergistic effect on our unconscious motivations and raise ethical issues. Here are the categories of experiences as Groff described them in non-ordinary states. 1. Sensory experiences and motor manifestations. Could be tetany, tightness, pain, numbness, tingling, temperature fluctuation. 2. Biographical experiences of events that have happened to us from birth to the present time, positive and negative, releasing trauma, omission and commission, grieving. Reliving is more than just remembering. 3. Perinatal experiences. From the fetal experiences during gestation and pregnancy through the birth process, to the experiences immediately after birth, complications of birth, anesthesia, birth as a sexual experience. And 4, transpersonal experiences, which can take us beyond our bodies and our own personal ego identities. Conception, unity, out-of-the-body experiences, merging with other life forms, becoming one with the elements, past lives, communication with archetypes, yogic sleep states. So ethical issues pertain to longings, feelings, and motivations which resonate at our very core. The most powerful forces in our lives are our drives toward and away from change, money, sexuality, power, love, truth, inspiration, and oneness. The most profound or intense moments in breathwork are when those drives are directly encountered by both the facilitator and the client. The keys to professional ethical behavior are authentic caring for self and other, coupled with a willingness to examine our own motivations, willingness to tell the truth to ourselves, to our peers, and to our clients as appropriate, and a willingness to ask for help and learn through observation, consultation, training, and peer supervision. A list of ethical principles and guidelines for breathwork can be found on the Global Professional Breathwork Alliance's website. The GPBA is the professional organization which coordinates the standards for professional breathwork training and ethics worldwide. Therapist training. The first challenge for therapists in being an effective change agent and teacher of faster than normal breathing therapeutic breathwork skills is becoming safe and conversant with the nonlinear world of their own sympathetic nervous system. The interactive energetic systems in the consulting room require that therapists be clear enough of their own, quotes, emotional blind spots to be effective guides for clients. The helper must have the courage to be helped to greater levels of their own vulnerability and sensitivity. The comfort zone of therapeutic distance must be set aside when doing our own work as a therapist. The goal is to increase awareness of our own unconscious or shadow parts to effect greater self-integration. It ranges from difficult to impossible to lead a client down a path when one has not trod it themselves. The benefits many therapists have derived from accepting this challenge are a greater sense of personal vitality, increased ability to work with a variety of clients more directly and effectively, and less compassion fatigue as a result. I both serve and support my clients and see them as mirrors in whom I witness the parts of me that are in process of healing. Through my practice of breathwork, I am well able to keep therapeutic boundaries, even more consciously, without distancing and labeling the client as sick or deviant. They energetically respond to collaborative work as opposed to being, quotes, worked on as a specimen. Now, I suspect most therapists would feel insulted by the insinuation that they think of, much less treat, their clients as specimens. Nonetheless, when clients journeying into an area of conflict and fear causes me as a therapist to subtly guard myself emotionally, often by retreating to a mental interpretation, advice giving, and or protective body language, impeding my own breathing, I'm conveying the subtle message of you're sick and I need to manage you. Many clients are all too willing to accept this label because they are not comfortable with their own feelings and have concluded something's wrong with them, as opposed to seeing their feelings as a form of emotional intelligence that is trying to communicate valuable messages. These signals can warn them before they engage in behaviors that get them less of what they really want. My job as a therapist is to help them free these messages from negative judgment and translate them into self-affirmation and productive action. An increasing number of psychotherapists have been seeking out therapeutic breathwork training in recent years. The following are personal accounts of therapists who have taken breathwork training to facilitate their clients in the process. Account number 1 is from Ron, a veteran psychotherapist who used his personal healing with therapeutic breathwork to inspire him to become a certified professional breathworker and integrate breathwork into his therapy practice. He shared the following experience of deep healing of his lifelong vertigo issues as a breathworker in a breathworker training. Never before in any form of therapy I had experienced had I ever been able to break through a wall that appears when panic and dizziness occur. At this point, in whatever mode I might be working, something would halt the process, and my breathing, of course, and I could not go any further. As I got deeper into this breathwork session, I encountered a deep sense of terror and blackness, and things began to spin. With encouragement, I was able to keep aware of my breathing and stayed with the process despite my longing to bolt and a flurry of beliefs that only suffering and no gain awaited me in this encounter. In reviewing the journal entry I made after the session, I described what I was experiencing as being in a dark and terrifying hell. I was aware of recurring fears of suffocating that I have often had in this kind of severe panic. This process helped me deepen my peace with my deceased mother and take me a step forward in healing the wounds connected to my absent father. Somewhere along the way in this process, I became aware that I had taken on my parents' fear of suffering. I believed that this was a way to try to have a connection with them, though with obvious limitations and consequences. I got clear that my parents were in their own lights and that I could love them eternally just as they are. This experience helped me tremendously and deepened my understanding and ability in helping my clients in the ways they try to connect through shared symptoms in a desperate effort to have a link in a larger and sometimes scary world. The benefits for me in this session have been astounding. I realized that panic and vertigo had been like a wall that I could never penetrate. And through this one session alone, I passed through that wall and began traveling the territory beyond. How incredible to be on the other side of something that I wondered if I could ever penetrate. This has provided hope and encouragement to me, especially at times when I get discouraged or doubtful if I will move through a particular issue. And I think I have been better able to bring that kind of helpfulness and hopefulness to my clients from an understanding and sincere place. At this point, I do not believe I would have been able to bring breathwork to others, but it launched me along the way. To have a breakthrough like this creates so much excitement, hope, and curiosity to learn more and heal more. And this has energized me forward in my own healing and in the ways I can assist others in their processes. Personal account number 2. Claire is a psychotherapist whose personal experience with therapeutic breathwork led her to its use with her clients. What most intrigues me about breathwork is the experience of discovery and the natural healing that takes place in a breathwork session. I have witnessed and have participated in discovery and healing in my 20 plus years of practice as a traditional psychotherapist, but my experience of breathwork brings a whole new dimension to my understanding of healing. As an example, I've experienced sessions in my body related to anxiety and depression released in the process of my own breathwork sessions. After a session, I most invariably feel a profound sense of peace, often without knowing the storyline attached to the healing. My conscious connected breathing discovered the pain and was the vehicle of its release. Traditional psychotherapy is sometimes so attached to the storyline that the relief can get delayed in order to satisfy the intellectual understanding. I am grateful that I became introduced to breathwork for my own growth and to enrich my therapy practice for my clients. Personal account number 3. Lily, a licensed clinical social worker, reports that awareness of the connection between her own breathing and anxiety has been a great asset in assisting her clients. As a licensed clinical social worker, I notice and think about what people are doing with their breathing from our first meeting on. I give homework of full belly breathing to do daily. This has lots of positive impact for people, decreasing anxiety, increasing the ability to fall asleep. I've often heard to say, take a big breath. Restricted breathing is common to almost everyone. Just working to open up clients' breathing changes a lot, increasing their ability to be more centered, more aware, and more connected to their body and emotions, helping release emotions rather than stuff them. The breath helps people hang out and feeling good, which is hard for many. We have been so accustomed to feeling less than. Personal account number 4. Sandra, an art therapist, has integrated her inspirational leadership talents into her work with some very challenging populations. At a summer camp for severely emotionally disabled youth, I facilitated circular breathing, slower than normal therapeutic breathwork breathing technique, at the beginning of our art therapy sessions each day. 30 teenagers surprised me by actually closing their eyes and doing the circular breathing without any disruption and without anyone refusing to do it. And they followed the directions perfectly as the room became totally silent. They were absorbed in the process. The camp director took pictures. She was amazed, it was later reported to me, how it helped some of them during challenging situations in the following weeks, when by themselves they paused and did the circular breathing to bring their energy back to calm themselves. Research. There have been numerous research studies on the use of regular conscious connected breathing programs, faster than normal breathing, in alcohol recovery, for example, with over 50% sustained sobriety. Other research has demonstrated the positive effect of breath modulation on anxiety and depression. There are a host of studies that cite the positive mental health benefits of holotropic breathwork, another faster than normal breathing technique. James Eierman, a psychiatrist and certified breathwork practitioner, did a study on the use of faster than normal breathing with 11,000 psychiatric inpatients from a variety of psychiatric units dedicated to various diagnoses, who participated in holotropic breathwork over 12 years at a community hospital. The outcome measures, transpersonal experiences were reported by 82% of the participants, and this procedure was well received. No complaints of adverse reactions were recorded during the sessions or afterwards on the clinical units. There are also numerous studies affirming the benefits of mindfulness breathing, a slower than normal breathing modulation. A list of breathwork-related research can be found on the Global Professional Breathwork Alliance site. Now, my 33 years of courses in integrative psychology and breathwork are available online at transformationsusa.com and through our in-person and virtual training programs. I now virtually train and teach internationally. I invite you to investigate our training programs and give yourself the opportunity to open doors to life-enhancing personal and professional growth. Our trainings are approved for professional continuing education credits in the United States through the National Board of Certified Counselors and the National Association of Alcohol and Drug Addiction Counselors. Contact us at transformationsusa.com or area code 414-351-5770. I look forward to sharing Breathwork's role as it is integrated into psychotherapy and all other healing arts, or experienced on its own.